Thank everybody for coming to our session. So we're going to start with our panel and the title with Health at Every Stage. So supporting women's choices and challenges. So I'm going to let each of you introduce yourself as well as your organization, and then we'll talk about our first question. So we've got 4 questions.
Am I starting? Do I get to start? Hi, my name is Carrie Krebs. I'm the Executive Director at Florence Crittenton Family Services. We're based in Helena, but serve families statewide. Just a tiny bit about myself. I got into this work in a very long and winding road. I started in architecture at Montana State, go Cats. And I ended up graduating with a business degree and an entrepreneurship minor, and ended up in athletics, and somehow that led me to healthcare, which somehow led me to running a human services organization. So a very long and winding road, but I got to Florence Crittenton 15 years ago, and I found my home and I found my passion, and I've been the executive director for 5.5 years now. So it's been a really amazing journey. Our organization is 125 years old, and we're kind of in this intersection between mental health facility and human services organization. Our really founding principle is that we believe that every child deserves a family, and every family deserves a chance, and that can lead to a lot of complexities, and really offering a continuum of mental health, behavioral health, and housing services to families. So we've served 20,000 plus families over 125 years from every county and 13 other states. Really where our most known for is our residential programs. We have a youth maternity home that serves moms ages 12 to 21. And then a substance use recovery program for moms ages 18 to 35. And the unique part about our programs is that their children can accompany them to treatment and in living in our residential programs. We have a whole lot of other services that kind of follow in the continuum that include community-based parenting support, as well as outpatient clinical services, and then childcare, because if you're not serving childcare, we can't do all of the rest of the work that we're doing.
Hello, everybody. My name is Stephanie McDowell. I'm the Executive Director at Bridger Care in Montana Family Planning. And Bridger Care is your local nonprofit family planning clinic. We've been here for over 50 years. We live next to you in this valley, we work next to you, and we really care about the community. We like to say the personal is professional and the professional is personal, because the care that we provide also impacts us as people. And that's fun, because that means we can really approach our work with a lot of empathy and passion. So I'm going to talk about our services and then just talk about a couple of our bigger programs. Our services include just what you would think when you think about family planning. So birth control, annual exams, so screenings for breast, cervical, and testicular cancer, STI testing and treatment, gender-affirming care. We do LEAP treatment, so that's a treatment for pre or current cervical cancer, ultrasound, and then we also have been expanding our services this year. We've expanded our services for infertility, so now we're doing intrauterine insemination and fertility monitoring. We've expanded services to include menopause care and perimenopause care, because we all know that that's a kind of care that doesn't get a lot of attention. We've expanded into erectile dysfunction. We serve people of all genders. And then we are also adding vasectomies this year. So really just doing our best to help our patients. And all of our services are on a sliding fee scale. So that means when you come to Bridger Care, whether you make $0 or $1 million, you're gonna pay according to your income. You don't need insurance, you don't need Medicaid. You can have either of those, and we welcome you. One of the things that I think people misunderstand about nonprofit sliding fee clinics is that if you continue to come to us, you're taking a spot from someone that needs it. when in reality, we're kind of like a health co-op, where if you have insurance and you come to us, that actually helps support a patient that doesn't have insurance. So we encourage you to come to us consensually, of course, if you want to come to us. We encourage folks to stay with us, even if they have insurance or can afford private practice. So that's our services. A couple of the bigger programs that people aren't normally aware of what we do, Bridger Care receives the federal Title X grant for the state of Montana. So we receive annual funding and distribute that funding to 20 clinics around the state of Montana. And then we support them to stay in compliance with the federal family planning program. Bridger Care happens to be one of those sites. So we receive this federal grant, we give it to ourselves, and then we give it to 19 other clinics. 4 of those are Planned Parenthoods, 3 of them are federally qualified health centers, 13 are health departments. If I did the math right, hopefully nobody's counting for me. So most of our sites are located in really rural, frontier, isolated areas, and we're the only place that people can access contraception. So really vulnerable populations where if we were not there offering a contraception on the sliding fee scale or health screenings, they would really have nowhere else to go. So that's our focus is funding and providing support for family planning across the state, as well as here in Bozeman with Bridger Care. And then the last program is our Teen Pregnancy Prevention Program, which is our education department. And we believe that prevention and information is how we empower people to make decisions for their lives and achieve their full potentials. So we have a group of 20 peer educators that educate their teens. They get together every week and learn about sex ed, consent, healthy relationships, how to talk about those things, and then they share that information with their peers. They go into youth-serving organizations and provide that information. And so that's our education department. And then I would say, just in general, being a resource to the community, coming to things like this, sharing information. If you ever have questions, we love to hear from people in the community, people around the state. So always feel free to reach out.
Hi, everyone. Thanks. It's nice to be here. I'm Heidi Duncan. I'm a family medicine physician. I'm going to talk a little bit about myself first and then talk about the organization, because I think as we talk through the questions later, there's a little bit of what I do every day in the clinic and what we do as an organization that's sprinkled throughout all of this, so it helps to have context. So I grew up in Western Montana, came back to Billings after medical school residency, and I've been there for 30 years now. I still do family medicine 3 days a week, and then I do health policy work for our system 2 days a week, so things are busy right now with the legislature, as you all know. But in my practice, I take care of birth to death. I have 3- and 4-generation families that have been with me now for a long time, since I've been there a long time. Delivered babies for 21 years. So personally, do a lot of women's health care. But then as a system, being part of Billings Clinic, I also wear the hats of serving on the board of directors for Billings Clinic for 4 years, and then when we integrated with Logan Health about 1.5 years ago, I'm now also on the system board of directors. So there's a lot of kind of looking at the state and the healthcare map of the state. So about our organization a little bit, we're the largest now community governed, which is really important to us, Montana, Wyoming-based health system that really is committed to providing a full spectrum of care, kind of primary care up to some of the more specialized services across the continuum, partnering with communities as they're asking us to come in and partner with them to support local healthcare services and really keep access local, keep care local as much as we can. And that's kind of a core philosophy of ours, is really wanting to have people get access to care, as we'll talk about being important more later. Some of the things that specifically our system does that I think are a little bit unique in the women's healthcare space are the reproductive endocrinology and infertility program. That's primarily based here out of Billings with Dr. Sciamento. We're one of the first places, I think, to do GYN oncology. Other players have come into that market now, but our GYN oncologists do a lot of outreach to communities, and we have specialists that do that as well. In the pediatric subspecialty space, we've done a lot of that, and partnering with Logan Health has kind of expanded that network, and I think that's important since women are the caregivers for their kids, and really getting that access to pediatric subspecialty care is exciting, and being able to expand that outreach and do that in a partnership so we can do what makes sense for our state. We have a partnership with Children's Hospital of Colorado, and then Billings Clinic is also part of the Mayo Clinic Care Network. So we're trying to bring a lot of resources, healthcare resources, to the people of Montana, the women of Montana.
Thank you all so much. And I guess I got a little nervous and forgot to introduce myself. So I'm Coley Wingo. I live here in Bozeman, and I am so proud to work with Billings Clinic here in Bozeman. I've been with the clinic almost 4 years and been in Bozeman for 30. So prior to healthcare, I was in hospitality for almost 20 years. So it's been great to be in this community, and certainly just wanted to find a new career path that I would be able to give back to the Bozeman community. And I feel like Billings Clinic has done a great job to open up healthcare access for everyone in the community so you don't have to wait so long to get in and see a doctor. So we will start with our first question for the panel. So how is it addressing healthcare for women at every stage of life?
Do you guys want to go first? I feel bad going for you. Yeah, we'll switch it up. Do you want to go first? Yeah.
Yeah, I think there are a lot of challenges that are facing women with healthcare always, but I think from my lens as I was thinking about this question is helping women navigate the healthcare journey for themselves, but also as the primary caregivers, oftentimes for their family. There's lots of studies and statistics about that, but just anecdotally, we've all lived that. Whether it's like your core family or your extended family, I think that the thing of the sandwich generation is something that I'm talking about with people every day. Women who are often in their own intense career trajectory of their busy professional lives. A lot of us are delaying childbearing if we're having children, and so you may have younger children while you're in that career trajectory. Our adult kids are taking more care and resources longer into their lives these days, and then on the other side of things, we have parents living longer, so that we're having more and more caregiving needs for our extended family, our parents, our aunts, uncles, grandparents. So I think that helping women navigate all of that is one of the big challenges, and I think as kind of subsection of that, you had mentioned this, Stephanie, I think things like menopause, that there's lots of areas in women's health care that we just don't know a lot about yet. The research just wasn't there for years. A lot of us are living a lot longer into our menopausal years. Some women do it so easily, and oh my gosh, for some it's awful. It's all real, that weight that goes on here that doesn't come off, the brain fog, the night sweats, the hot flashes, the sleep disturbance. So I think there are a lot of opportunities there. I think figuring out all that together and just acknowledging that exists is important, and then doing the work to try to address it.
I would echo everything you just said, and thank you for acknowledging all the symptoms of menopause exactly as you described them. I would echo, we primarily serve folks who are in their 20s. That would be our largest age group. But we are certainly seeing a lot of teens and then people up into menopause. Just the nature of being a sexual and reproductive health care center, we're just going to see a lot of folks in their 20s, especially when they need sliding fee scale services. They're people typically not making a living yet or living paycheck to paycheck or still in college, and so they really need our support. But what we're finding is as we expand care to kind of taboo healthcare like menopause or infertility, more people are seeking out care that is open to having conversations about the kinds of care that are not often given the attention that they really deserve. We're half the population, and the healthcare and the research around the care that we need is way underfunded and way under-resourced and not prioritized in our systems of healthcare. So the more that we normalize and make the care that we provide from, puberty or post-puberty up into menopause, the more we see our patients really responding positively. The one other thing I would say is I've been doing this work. I've been at Bridger Care now for 21 years, and I started to notice probably 15 years ago a real shift in culture around family planning. And so it's definitely becoming more difficult to provide this care. We aren't just a healthcare clinic. We're kind of controversial now. And that's very strange, because when I started this work, it was contraception makes sense, right? We should provide contraception to people who don't want to get pregnant but can't afford contraception. This makes complete sense. But now I'm in a space where there's a lot of objection to the work that we do. And I have a hard time connecting the dots as to why. And of course, we don't have to get into that logic, but that would be one thing that I see shows up in the exam room with our patients as well. Our young people are scared about their rights, their bodily autonomy, their freedom, their future, and are experiencing a lot of mental health issues because of those uncertainties. So that is something that we are having to shift the care that we provide to really say, okay, now we're going to bring mental health care into the clinic because it's impacting our patients and impacting their lives and their futures. So it's not the same work I started in 21 years ago. It is absolutely different. And I'm having to do a lot more advocacy than I've ever been asked to do in my career, and that's great. I'm happy to show up for that, but it does get confusing, I would say.
I think the lens, that I see this women's healthcare through really is that mental health, what we would consider behavioral health. So mental health, substance use disorder, and such a significant rise in that over the last, like you'd said, over the last 15 years. And I think a lot of these things are tied together with each other. Thank you. And so I think that's really what I have seen as such a challenge. Where we had 15 years ago when I started, you can imagine our maternity home was, that serves moms ages 12 to 21. So you can imagine those are incredibly extreme circumstances, and those still very much exist. I wish I didn't have to take a 12-year-old in. I have a 13-year-old right now. And those very extreme situations still exist, but it's scary how that's moving farther into the community, and I don't know that I really understood how devastating the substance use disorder, the addiction world is in Montana, and how it is affecting every single generation now. And it's really affecting women in such terrible ways. It's really hard to see the shame and the guilt that comes with that, with substance use disorder. It's hard to see that our society still believes that mom is making a choice between her mom and or her baby and drugs. I have people say that to me all the time. She chose a bar stool over her child. No, she didn't. She did not make that choice. She is struggling with that every single day. And the caregiver role that women play really, I think, affects our ability to access healthcare at times. We always put the superhero cape on as women, whether we're caregiving for our children or our parents or our family members. We really put ourselves aside. I dealt with that myself 3 years ago. I'm the only person that COVID's life saved because I thought the little niggle in my chest was just anxiety, and it turned out I almost died of an aneurysm and had open heart surgery at 41 years old. And it was, I really wanted to ignore it because I didn't have time to be sick. I didn't have time for those things to happen, and I excused it away. And ironically, it wasn't until somebody said, you lost your mom for the same reason. Do you really want to do that to your kids? And it wasn't for me. I did not go to the doctor for me. I went to the doctor for them. So I think that is the one good thing that we have for women, is that we will take care of ourselves if it's for somebody else quite often. And I see that all the time. When we have moms that have the opportunity that they don't have to make the choice between their children and seeking treatment, the fear of losing their children if they divulge that they have a substance use problem. There's a Meadowlark initiative for that reason. The fear that they have about that, but when they're given the opportunity to not have to make that decision of their kids or getting better, they will fight so fiercely to be on a road to recovery and to get better for their kids. And I think there's a power in that. It's really hard to see sometimes that it takes somebody else, but I think there's such a power in that in women, and I think there's such an opportunity for us to walk alongside women and help them understand, how powerful they are, and that taking care of yourself, whatever that means, mental health, physical health, whatever that is okay. It is okay to take care of yourself.
Well, with that said, our next question is going to be, what do you believe are the most pressing health challenges facing women today?
I'll go for this first this time since I haven't gone first yet. So I would say I work in sexual and reproductive health, so that would be my response. Like right now, I just have deep worry about access to sexual and reproductive health care. And I'm sure when you hear that, you think abortion. But for me, it really goes deeper than that. Like I'm observing, and I mentioned this earlier, a real shift in birth control and attacks on birth control, IVF. There's new trends around undermining prenatal testing and how safe they are. So I'm going to talk about those things because I feel like we have a lot of education around abortion, and I do want to provide some more information about the other attacks that we're seeing. So with contraception, attacks on contraception are not going to be blatant because they know if they outlaw contraception, everybody is going to lose it because 99% of us have used contraception in our life. So when you undermine access to contraception, it's like very coded, it's very slow, it's like written into things that it would take an expert to understand. And so where we're seeing this happen is like the Right to Contraception Act can't pass. We see governors in Nevada, Florida, Missouri, Louisiana, blocking bills that would protect access to contraception. So we see people on the record saying, no, we aren't going to protect access to contraception. It looks like an insurance company refusing to pay for an IUD because of religious refusal, or a pharmacist refusing to fill a birth control refill because they object morally, and that's legal. That's where we see erosions in access to contraception, and we're seeing more and more of those. We're seeing them in our state. We're seeing them in many states across the U.S., and we're not getting protections at the federal level. IVF, that one took us by surprise, right? Because we were told if we're the type of women that want to be pregnant, then we are protected. And that switch told us that was a lie. We are not protected because when you give up control over your pregnancies and your body to the government, or when they take control, that includes any pregnancy. That includes our embryos. And that's what's going on with IVF. And then lastly, the prenatal testing. This is a newer trend. And I'm sure many of you kind of see this with birth control. There's this influencer trend to be like, birth control is bad for you, you should detox from it. And like it's this happening at the lawmaking level, but there's also this like initiative to have it creep into our culture. This is now starting with prenatal testing, where they're starting to undermine the safety of the testing, that it's a money-making industry, that they're forcing this testing on people. Because when we use storytelling about needing an abortion because our pregnancy had a fetal anomaly, it was a doomed pregnancy, and we needed an abortion, they don't like that story. And so rather than saying, okay, we're not going to allow those kinds of abortions, they're going to instead go after the tests that give us the information we need to understand and make a decision for ourselves. And that is the kind of stuff that makes me really worry, because if you don't know what you're looking at, you don't know that your rights are under attack, because it's coded, it's slow, it's hard to understand. That is what I see as the biggest threat.
You know, I think we've been talking a lot about this, and even just what she was saying. I think one of the biggest challenges that face women in their health and their health care is how complex our health care is for women. Our bodies are very complex. They're not built like the other gender, but the other gender is most often the one that research studies and things are done. So just the fact that we're just now starting to talk about menopause, you know, at this point in society or humanity, and now it's like this newfangled thing. I mean, that's crazy, right? So the fact that there's so much complexity in that research is based typically on males. They almost didn't do my heart surgery because my aneurysm was not measuring big enough to fix. It was measured off a 65-year-old man that's 6 feet tall. I am not a 65-year-old man, I'm not 6 feet tall. My aneurysm was twice the size of my heart. But thank God I had a female doctor that was like, that's not right. I do not feel good about what we're seeing here. But it took somebody really having to work hard. I had that echo for 3 weeks before somebody decided, you know, that maybe we should do something. So I used like personal, you know, kind of piece of that, but it is complex for women to navigate our healthcare. Our bodies are very complex. Mental health plays a massive part in our physical health. If we're not dealing with our mental health, oftentimes we are ignoring our medical health, and it's affecting it. The body keeps a score. Trauma is so real, and it absolutely does affect us. So I think that complexity and with women having to navigate all of those different things, and then on top of it, even just being able to access care is a very controversial thing for everybody. Everybody wants to talk about women's health. And so that puts a ton of pressure on us to do the right thing by ourselves, but also by society. So I think it's just really that complexity and that pressure on women is probably one of the things that I see that puts women at most risk.
Yes, all of that. And I just want to, I think I want to just put a little exclamation point on the mental health part of things. I was commenting to one of my partners in the clinic the other day that I feel like there's like a little bit like our speaker at lunch talked about today, the uncertainty in the world right now. There's always anxiety. I mean, we always have lots going on. Like you said, the complexity of the health system, all the things that we as women have to deal with that we've talked about already. But I also think that there's kind of another level of anxiety that's back similar. It reminds me of those first few months in 2020 when COVID first hit, and there was so much anxiety and so much uncertainty, and what does this look like, and how do we navigate all of this? And I feel like there's kind of that level of uncertainty and anxiety again that I just think we have to acknowledge and lean into it and figure out how to navigate through that as well.
Well, with that said, how do economic disparities impact women's health outcomes, and what can be done to close these gaps?
I think we've all kind of touched on it already, but to me, where the biggest economic disparities, the biggest impact of that is the access to health care. And there's so many different layers of that. Whether you're talking about, are there enough physicians to take care of you in your community, whether it's primary care or specialty care? Do you have insurance or not? I mean, that is a big thing, and thank goodness for organizations like Bridger Care who do offer some sliding scale services, but most all health systems in the state do offer services, and I think sometimes people are afraid to ask about that. But everybody, especially the not-for-profit hospitals, part of what we have to do, health systems, is what we have to do is provide that some sort of access to care. So I think that there's a lot of different layers of that. Insurance, ability to pay is often a barrier. that is real and it's there. It doesn't have to be, and I just think we need to partner, put the word out within our organizations, partner with our community partners, and help people navigate, again, this really complicated system that you were talking about.
The people that we serve often can't afford health care, so we see firsthand how economic disparities impact people. And one of the mandates of this federal grant that we receive is that we provide care to people regardless of ability to pay. And to me, that feels like almost like a civil rights issue, like you having the right to decide if and when you want to have a family feels like a human right. And so I'm very passionate, obviously, about our work, but I love to tell the story about my mom because I think that is why I really got into this work. So she was born into a family. There were 6 of them, 6 girls, and she was born into extreme poverty. Her dad didn't finish 5th grade. Her mom didn't finish 8th grade. They both had to drop out of school and start working, and then they had their 6 kids. Her mom died when my mom was 6, further putting them into poverty. They couldn't access health care. Probably why my grandmother died was that they couldn't access health care. So just generation after generation of poverty was what my mom was born into. And then these 6 girls came of age when birth control became legal. And every single one of them is a taxpayer. They go on vacations to see their grandkids. They have expensive hobbies like quilting. Like apparently quilting is a hugely, enormously expensive hobby. They're like in one generation, they came out of poverty. So I think about where I would be if that hadn't happened, if birth control, I would be in poverty because that was what my ancestors were living in. I do want to caveat this story, though. My mom is a white woman, and she grew up in North Dakota, and she lived a couple of miles from the Turtle Mountain Chippewa Reservation. And so the time where she was coming of age and getting freedom over her reproductive life and her future, the women on the reservation were being involuntarily sterilized at incredible rates. They have documentation of up to 25% of indigenous women at the time being unknowingly, non-consensually sterilized during other procedures. Who knows what the actual numbers are? This is just what they've documented. So at the time when my mom, a white woman, was experiencing freedom, her Chippewa counterparts 2 miles away were having their freedom taken away through essentially genocide. So I want to caveat that story and just own that that isn't going to be the same story that I experienced. But I love that story because my mom and my aunties, they're just like living their best lives. Thank you, birth control.
It's really hard to go last because you get so engaged in what they're saying. You're like, oh my God, I have to answer this too. So ditto a lot of those things. And I think, the majority of the families that I work with, access to care, economic disparity is forefront every day for us. So I can tell you that accessing care, while it feels like there are a lot of opportunities out there, navigating that system when you already don't have resources is really, really, really challenging. And again, I know I kind of have an overarching theme, but I just see it so often. There's also, again, this overriding kind of guilt and shame and a little bit of embarrassment that keeps some of these women sometimes from accessing and going to the Medicaid or the OPA to get their Medicaid, and their housing is very untenable. And I don't know if everyone knows, but most of the time you find out that your Medicaid is lapsed because they send you a letter. Well, if you're living in your car with your 2 kids, they send it to whatever address they had last, which could have been 20 years ago when you yourself was a kid, and they don't care. That's just what it is. And we spend more time. I actually have a direct line to Medicaid, Montana Medicaid. I'm not giving it out. Promised I wouldn't. But I actually have to call them sometimes and say, where was this person's letter sent? And and they're like, oh, here, why didn't they get it? I'm like, well, because they haven't lived there since they were 3. So that navigation is really, really difficult, and it keeps them from going back and accessing care. So I've had this happen. I don't know why this keeps happening, but calls from our case managers at the pediatrician's office. 15-year-old mom just had her kiddo. By the way, a 15-year-old mom that is in CPS custody doesn't have access to her own health care, but she can make all the decisions for her child. Very strange. So she has decided to maybe do a circumcision, and she gets to the clinic and they say, your Medicaid's lapsed. We will not do the procedure. You owe us $300 today or you're walking out. It's already taken her a lot of energy and courage to go there to have that procedure done and advocate for their child. Well, she just wants to turn and walk out the door and I'm never walking back in here. It's humiliating. It's all of those terrifying things. So I have had our case managers call, and I'm like, just put them on the phone. And I'll just give them my credit card number. I'm like, we will figure this out later, because that is not gonna be the starting point for her trying to access care for her kids, and that level of humiliation that never has her go back. So access to care, again, is a very complex thing. Like I said, all of those other indicators for health play a part in that. Housing, if you are homeless, it is really hard to get the right pieces in place to access the appropriate care. And I think that's just something that we don't always think about at that level. And I will say, just, the invisibility of women in our Indigenous communities is terrifying to me. 80% of our youth maternity home clients are from reservations, and I often, when they get to us, I have no idea how they have survived even the 13, 14 years that they're alive, and the atrocities and what they have been through. And honestly, getting pregnant with that child, quite often they will tell you has saved their life, because it's got them, kind of out of that situation. So it's a deep wound, I think.
Well, that leads into this next question. What role does mental health play in supporting women's well-being? And with that being done to address this within your and what is being done to address this within our organizations?
I'll start that one, because that's that's a little bit of our wheelhouse. So that's what we do. Mental health, like I said, plays such a massive role, and complex behavioral health is really what we look at. I think the other part that we don't often think about is that maternal health really affects your mental health as well, and sometimes in a really positive way, where if you're struggling with mental health, the hormones of being pregnant actually can make you feel amazing, and it can almost make you feel like your mental health has gone away, which kind of then starts looking like you're addicted to getting pregnant. You're kind of addicted to the feeling that you have.
I'm sorry to interrupt you, but we have a medical emergency in the lobby. Is anyone
Dr. Duncan.
No, I'm glad that she was there. So I think that, again, it does play a huge role in us accessing care. If our mental health is in a place where we can't get out of bed, or we're utilizing substances at a level that it's affecting everything else, it masks a lot of our health care. It, again, prevents us from accessing the care that we need. And I really think that is at the core of so much of what women struggle with. Like I said, that's what our organization does. Our job is to take families in, especially in our residential programs that are obviously the most intense, is really to take a mom in and help her get an appropriate diagnosis. It is shocking sometimes in mental health how challenging that can be. So we help with that, create treatment plan for mom and her kiddos. Case management is huge in accessing mental health. And then obviously providing a stable place for them to live while they're on this recovery journey, or accessing their mental health and addressing that, therapeutic support. And then, of course, discharge planning and medication management. So those are the pieces that we take care of, and then we get them access to their physical care. So we don't actually do the physical health pieces of it, but we intersect with that community so that they do feel safe in accessing that care and learn how to do that, and how to do that for their children on a preventative level as well.
Ooh, I just want to take a breath, because I know we just saw one of our panelists run out, and I'm sending her thoughts out there. And way to stay focused. That was impressive.
I know.
So yeah, just thinking about those folks out there right now. Mental health, so important. I echo everything you just said. I think what we see often is folks coming in with physical manifestations of stuff that's happening, like mental stuff. And it's really interesting, again, lack of research. But like our folks that come in with pelvic pain, a lot of times it's tied to trauma. And like we'll run all these tests and try to diagnose the pain from like a physical perspective. And when we get them looped into mental health care, they find a solution and they start to recover. So mental health, absolutely, we're seeing that in our setting. At Bridger Care, we've always provided medication management and diagnosis for anxiety and depression. And then if we feel like someone is outside of our scope, we help refer out for like a psych eval. But what we discovered was that our folks were not, if we were referring out for counseling, like to heal through trauma or, life skills, things like that, they weren't accessing the referral because it's really hard to find a counselor. And it's not one size fits all. You might start with somebody and then you're like, this isn't really my jam. And then it takes weeks to find another one. And they can only get you in at 11 on every Tuesday and you have a job. So understandably, our patients were not accessing referrals. So in 2021, we decided to bring mental health care into the clinic. And we do this model called collaborative care. So our provider, every time we see a patient, we screen for mental health just like we screen for blood pressure. So we do what's called a PHQ screening. And with that screening, we find out if they have really high scores or low scores. Do they need a referral and assistance, or are they okay and we're good to proceed with the visit? The reason we treat it like a vital sign is that most of our patients are not going to have blood pressure issues. We're generally serving pretty young and healthy folks. So if we ignore this important vital sign like mental health, that's where we're actually doing our patients a disservice, because that's what's probably impacting their health more than blood pressure and weight and BMI and all the other things that we like to measure in medicine. So when we started doing these screenings, our healthcare providers say they have a patient with a relatively high score. They'll offer mental health services, and then we can make a warm handoff to our social worker who's located in the clinic. Those two partner on the care plan and the treatment plan, with our provider doing the medication management and our social worker doing the counseling. And the idea is that our patients essentially graduate out of the program. So we take their score every time they come in for a visit, and when they get to the point where they're having low scores repeatedly for a while, they can graduate out of the program and do medication as maintenance. And then if something happens, they can come back and see us again. We see this a lot with seasonal stuff, like wintertime people really need help, and then summer everybody's like, no, I have 3 months. I don't want to do anything. I will say, too, the other thing about doing those screenings as a standard, we're also really able to identify folks who are dealing with suicide ideation and really get them into some safety planning. If we didn't ask, we wouldn't find out. So it's been really lovely. One of the statistics that I think really reinforces why we love this model is that if you do medication management and counseling separately, you'll see a 40 to 70% success rate. If you combine them, you'll see an 86% success rate on the treatment. And so that's what we're seeing with our patients now.
I would just add just really quickly, I think what you heard us both say is that the collaborative aspect and integrating our healthcare has been so important, I think, for everybody, but especially for women, because that warm handoff and that trust is so important. So we do the same thing, just like I said, we get to a certain point, like the physical healthcare for you and your child, we need to get you to somebody else, but we receive referrals all the time from places like Bridger Care, where it's like, we've got this pretty significant thing, here's where we're at, but because that call is coming from their trusted provider, they are far more likely to follow up on that next step. And so creating a relationships are so important for women, and trust is so important, especially if they have gone through really difficult things where there is a lack of trust. For our young moms, trusting adults doesn't even exist. Every adult that's been in their life has been a terrible person, has taken advantage. So really creating those trusting relationships and for us to do that as providers is really, really important.
Well, I think this last question is a great segue, and it's one that I've been kind of seeing as almost a theme, so thank you for coming up with this question. But what do you all wish you could tell your younger self?
Listen to your gut. I don't know. I think that's trained right out of us as women. Just ignore it. It's fine. Just push it down. Whatever it is, your feelings, physical health, whatever it is. I think trust your gut. Know that I need to also trust myself when I know it's time to speak up about something or that I feel passionate about and I have a knowledge base in it. I spend a lot of time. I did that at the legislature, for example, for a long time when I got in this job. The first 2 sessions, I just sat there and I'd come with a piece of paper in my hand and I wouldn't stand up there. And now I'm the person at this point, they're like, oh, dear God, why is she standing up? I'm like, hey, me again. And some of them are like, no, just stop talking. You are so annoying. But I think but I don't stand up there when I don't know what I'm saying. So it's that whole idea of trust your gut and you know more than you think you do. And when you do, speak passionately and be genuine about it. And I think you can make a difference in the world, even if it's in a very small part of the world. But I really do think that's kind of what I wish I would have known a few years ago, just a few.
Oh my gosh, that was so my answer. I'll think of another one because that was so my answer. But I love it. I know, high five because it's definitely how you feel as a younger woman. I will say the other thing I'm starting to notice the older I get is I wish I learned earlier how to engage in healthy conflict. Like I was taught to avoid conflict and to appease, and actually engaging in healthy conflict is wonderful and lovely. Like, why would we all agree about everything all the time? It's just not going to happen. So how can we listen to one another and respect one another while not agreeing and find an understanding together? And I think we're missing that a lot right now in this world. That would be one other thing I would add.
Yay! A hand for the doctor.
Thank you, Dr. Duncan. Oh, goodness. Well, your perfect timing. Thank you. So our last question, Dr. Duncan, was what do you wish you could tell your younger self?
Don't worry so much.
Yes.
Somebody put a sign on my desk at Billings Clinic the other day, and it's one of those cute little wooden signs, and it says, be a warrior, not a worrier. And I'm a big worrier, but I'm going to become more of a warrior. So, well, thank you, Carrie and Stephanie and Heidi. We appreciate your time today, and thank you, everybody, for attending this session. And let us know if you guys need anything in healthcare.